Find out more and take your browser over to supertalktv.com. You'll see I'm not alone in the studio today. I have with me Jan Dawson with the Mississippi Public Health Institute and Colonel Maxwell, Director of Mississippi Bureau of Narcotics. And when he's here, we are up to talking about good things, but it may be a little bit of a tougher topic today because sadly, large number of Mississippians are dying of a drug overdose. But the good news is we want to end the drug overdose epidemic here in Mississippi. And you guys, as a partnership and with some other organizations, are doing that through Make Mississippi OD Free, which is odfree.org. So good stuff, tough topic on a Monday, but it definitely needs to be talked about and talked about and talked about. So, Jan, you kick us off. How did this get started talking about that there needed to be a website or a funnel of information or just more awareness to the overdose epidemic in Mississippi?
Well, through a grant that we had funded with the Department of Health, a partnership was developed between the Mississippi Bureau of Narcotics, the Department of Health, the Department of Mental Health, the Board of Pharmacy, and then eventually Mississippi Public Health Institute became a partner in that as well to look at data as it related to overdose deaths in Mississippi, crime that was related to opioids, and different issues that surrounded the opioid epidemic. And as a result of that, once we began talking about we were putting out a quarterly report, and then we were putting out a yearly report that showed all that data. And in the process of that, we realized that we needed to be getting it out in a more public way, and we wanted to be able to do things in more of a real-time kind of situation, a place that was a repository to how to create information and education to help keep Mississippi OD free. And so that's how the process came about. Those are the people that had this vision. And through a subgrant with Mississippi Public Health Institute from Overdose Data to Action, a grant that the Department of Health has from the CDC, we began to develop this concept and put this website together.
And I think it's important and it's a good thing to know the numbers. And I know, Colonel Maxwell, you guys see so many numbers coming through there at the Bureau of Narcotics. Some good when it comes in pounds taking off the street, then some not good whenever, it's deaths related to overdose. How long has this been trending up? I mean, any death to an overdose is tragic and unfortunate, but it does feel like there's been a trend in the upward sort of way. And how long has that been going on?
Well, if we were to look at national data that has been provided to us from the CDC from 2015 through 2020, there was a 75% increase in drug-related overdose deaths nationwide. Mississippi paralleled that trend. We had an increase in drug-related overdose deaths from 2015 through 2020, and in 2020, we had more than 529 Mississippians die as reported to the Mississippi Bureau of Narcotics.
And those kind of numbers, man, when you think about the data, Jan, when Mississippi Public Health Institute gets this, what are they doing with these type of numbers or these type of statistics? I mean, before you having that outlet of the odfree.org.
Well, we have several ways that we use that data. First of all, we do still produce the Opioid and Heroin Data Collaborative Report, and it is actually published on the Department of Health's website. But we also look at that data and we use it. We have some county level data, and then we have some that is state level data, and we use it to plan prevention programs. But we also use that data to plan training programs so that we can educate people in all of these workforce areas, whether it is with the Bureau of Narcotics, with our partnership with some training that we've done with them, or with social workers, counselors, all different kinds of people. We've done some education with medical professionals, nurses, physicians, nurse practitioners on how to recognize when someone may potentially have a drug disorder. So we're doing a lot of training and education on not only how to recognize it, but also how to help get people into treatment or into programs that can help them.
And that all comes back to just better understanding the underlying problems, which the Bureau of Narcotics sees that firsthand, Colonel Maxwell. And so you guys are out there every day and you hear numbers like you just mentioned, and then an increase in 75%. But then Jan's telling us all this good stuff that they're doing. Why is the good stuff, you don't want to say stalling. I know it's working, but why are the bad numbers outpacing, the good folks on the ground working?
So when we look at the data, we have to understand that the drug culture is ever evolving, and it doesn't just impact one community or one specific demographic. What the data tells us is that there was an increase in drug-related overdose deaths among all demographics, and African Americans saw the most significant increase. African American males, 213% increase in drug-related overdose deaths, and African American females, 144%, which is an increase larger than any demographic, but it is impacting all demographics and all communities. And so for us, a critical piece of this is looking at the appendage crimes that extend out from the drug culture, if you were to use an octopus as an analogy, and you look at its body, its mantle, that is everything in and about the supply and the demand. But the appendages that extend out are drug-related overdose deaths, homicides, robberies, burglaries, pharmacy burglaries, the diversion of pharmaceutical drugs. All of these things, as a law enforcement professional agency, we are concerned about, and it has served motivation for us getting involved in these partnerships.
Which is helping it bring awareness, one thing. I think the more we bring it out of just the dark, which is not the dark for you guys, it's what you do every day, to us being able to talk about it and see it and sort of normalize it in conversation and not think it's just a them problem versus us problem, because now you're seeing it on the news. It feels like every other night, if not every night, there's going to be a story on, tonight about what happened in central Mississippi. And so how do you keep going, Jan? I mean, it feels like maybe it's an uphill climb.
Well, we recently received some data that in 2020, which was at the height of the COVID epidemic, the United States saw opioid use go up 15%. But in Mississippi, our percentage went up 30%. We know that the mental health issues surrounding COVID had a great deal to do with this. So when I see numbers like that, it gives me the spur on to write the next grant, to develop the next program utilizing this data. Who do we need to target? What does that demographic look like? How do we develop a media campaign that surrounds the people that we really want to touch? And that's how OD Free came about, was targeting those specific groups, and particularly right now surrounding Drug Take Back Day. What does the demographic look like that we really want to target to try to help get those drugs off the streets?
And that is coming up this weekend, I do believe, April the 30th.
April 30th.
There's 102 locations across Mississippi to take back unused drugs. And if you feel like it's hopeless, this is the good thing. This is the thing you can do to help. This makes an impact, taking a little time out of your day to look in your cabinet and then do something about it. So what are they looking for, and what can they do with it? So
a lot of people don't realize that unused drugs in their cabinet are dangerous to other people. First of all, we all know that, children are curious, and children can obviously get into those medicine cabinets, but that's not where our biggest issues come from. Almost anybody, if you talk to them, either suspect or know someone in their family or their close relationships that have a substance abuse problem. As I was stating earlier, we have had programs with realtors associations, because people don't think about the fact that there are unused drugs in their medicine cabinet when they're showing their house. We have worked with hospice agencies, because there has to be an appropriate way to dispose of those drugs. And we've also begun to look at other entities that we can work with in the future as well to try to dispose of those unused drugs. So our goal this year on Saturday is to try to get the tonnage that we could, and when I say tonnage, I mean tons of drugs that are taken back, increased. That is definitely one way to do it, but we don't want to limit this to one day a year. We want everybody to be aware that there are drug take-back boxes all over the state. As you said, 102 locations, and if you are unsure of where you can take your drugs back, you can go to odfree.org, and the locations for drug take-back boxes are listed there. If you don't have a drug take-back box in your area, you can contact us, and we can help you with some of those things. But law enforcement particularly will be very involved with drug take-back on
And we're going to learn
Saturday.
more about that, where you can find out the locations, what you can take back, why you shouldn't flush them down the toilet,
Yes.
and so much more coming up next here on Good Thing of It. And we're going to continue our conversation about making Mississippi OD free with Jan Dawson. She's with the Mississippi Public Health Institute, and Colonel Maxwell, the director of Mississippi Bureau of Narcotics. And yeah, I mean, as a mom, or, thinking about today's my mother's birthday, happy birthday, Mom, but she's the Nana to 4 beautiful kids. If she ever found herself having to make a 911 call like that, Jan, I mean, I can't even, I would, it's unthinkable, because the intention was never ill intent of having those things in the medicine cabinet. But Colonel Maxwell, how too often does this play out where y'all see narcotics ends up in the wrong hands? Prescribed narcotics ends up in the wrong hands.
Well, it plays out more often than we think. According to 2019 data from SAMHSA, each day 607 adolescents initiate prescription drug misuse, and those drugs are obtained from a medicine cabinet or medicine keeping space in a home. In addition to that, there was data also released that indicates that from 2016 through 2019, there was a 268% increase in pediatric mortality as a result of intentional and unintentional opioid use. And those prescription medications were also removed from a home medicine cabinet or keeping space. And so it happens more often than we think. We don't hear about the stories as much as I think we should, because if we did hear about them, we would have a greater degree of sensitivity and a higher level of alertness, and understand the vital importance of drug takeback, and the fact that those prescriptions unused can be placed in a repository in more than 100 locations throughout the state of Mississippi.
I just think about the frenzy that the media went through with just the pods. I think one kid or maybe 2 decided. We're not talking about the ones that chose to do it in terms of a viral thing that accidentally. You can barely get into those things now, right? And there is just so much awareness around putting those up or not having them where your kids can get them. And I feel like there's probably a little bit of common sense for most parents around their prescription drugs. But as your kids get older, there just needs to be a more heightened awareness that they may be more curious about that as they become less curious about the Tide Pod, right? Because it's sort of in their culture too to sort of think about these different pills and pill swapping. I want to talk too though about the counterfeit drugs, because it's not just what it used to be out there, right? Colonel Maxwell, I know the take back is prescriptions that's been prescribed legally to someone in the home. But what about all these others that are dressed like the pill they're used to, but there's something different in them?
So I think we have to continue to focus on the fact that the drug culture is evolving. Years ago, when I initially got involved in law enforcement, a large percentage of the drugs that we saw were agrarian-based. Cocaine derived from the coca plant, heroin at that time derived from the poppy plant, and, of course, marijuana. In order to get those products, you got to farm the crop first, and your labor cost is going to be exponentially higher than where we are right now in today's drug culture, where we see more synthetic drugs. All you need is a precursor of chemicals. And the most prevalent synthetic drug that we're seeing, and the most potent of all of them, is fentanyl. 2.5 milligrams of fentanyl is a lethal dose to more than 95% of the United States population. And fentanyl has properties that allow it to be pressed, cut, colored, and scored into fake pills. And if we look at data from a DEA public service alert back in October of 2021, of the 9.5 million pills that DEA had seized up to that point, 40% of them contained a lethal dose of fentanyl. So if you had 10 pills, 4 out of 10 contained a lethal dose.
That's crazy. And if you think it's not out there, I would encourage you to maybe do a little more research or be more open-minded if it's not in your backyard, because literally today, if you watch the news at all or any breaking here central Mississippi, I think we were talking 3 pounds or something came off the interstate of I-20. I mean, that's like 5 miles from my home. I mean, I know they were traveling through, but that kind of hits a little different, Jan, whenever you start thinking about your family being that close to it. But going back to the take back, we want people to get excited about being a part of the solution, and that's just getting them out of the hands of kids, particularly, or those that may be coming through your house. So what all are y'all taking back Saturday at the 102? And this is the big push. I know the 102 locations are open all the time, but Saturday's the big day.
Absolutely. Obviously, we really want to take back any kind of prescription medication. Big emphasis on opioids, but we'll take anything back. Anything that's expired, which can also be dangerous to someone in the wrong, in the hands of someone who doesn't understand. Or even older people, sometimes will let things expire. They don't check their expiration dates. So it's time to go to help mom or dad or grandma or grandpa go through those medicine cabinets and get rid of everything that has an expiration date or anything that they're just not taking or can't take. But particularly those prescription medications, we definitely want to get those out of the medicine cabinets. If anybody has ever worked with middle schoolers or high schoolers, we know that they're always pushing the envelope just to see what will happen next. And it is absolutely impossible at this point in time to tell what necessarily a pill is and what it's not.
Right.
And so you never know if your friend that's also at the party got their pills out of a medicine cabinet or got them off the street. And it only takes one pill to kill, and that's what our media campaign has been surrounding. That one slogan, one pill can kill. It's all it takes. Know where your kids are, know what they're doing, know who their friends are.
And it's one of those things I can feel like, you don't know if you prevented something by taking part of Take Back, but you don't want to regret not taking part of it if something was to happen, right? I mean, it's kind of like wearing your seatbelt. You don't know if you're going to get in a wreck between here and home, but if you do, you're really grateful that you had on the safety device that you have at hand. And so I feel like that's kind of the way to look at it. It's a prevention. You may never know, but you don't want to know the alternative to it.
You may never know who you save, but you may know who you kill.
Right. Wow. Well, that hit a little bit different, Jan.
Yeah, that's right.
And it shouldn't be funny, but and again, I mean, these are tougher things to say, but I look at it as it's an empowering opportunity to be part of the solution and let Colonel Maxwell's people take, down the big guys and not having it on the streets for someone to go and then sell or then to get into the, circulation. And so you're helping out, the Department of the Bureau whenever you take part in the Take Back. So you mentioned poundage. How much poundage are y'all hoping? Tonnage, I think, is the word
it's
you
tonnage,
use.
and that's hard to fathom the amount of tonnage that you take back. But we definitely want to increase the tonnage that we take back in Mississippi this year. Those drug take back boxes, for the most part, are cleaned out by the DEA, and DEA disposes of those drugs in an environmentally safe way to get rid of them. So we really want to increase our tonnage this year according to the DEA. And the only way we can do that is if everyone helps and finds their drug take-back box.
And why do we not flush them down the toilet?
Oh, it is not environmentally safe. And that is what, the DEA knows how to dispose of those drugs. We do have some other mechanisms that we can use, chemicals that will create, that will make the drugs inert, that we can utilize and the DEA will utilize as well, is a much safer alternative. Please don't flush them down your toilet because that gets in the groundwater, and of course that is a pollutant. Same thing down the sink. Please don't put them down the sink, and please don't throw them away in the trash because then they also become part of an environmentally unsafe issue.
And if you think, well, what's mine won't harm, but when we're talking about tonnage, then that starts to be a compounded issue, or sort of really quickly. Do we know about how much potentially is out there that could be brought back?
We don't know how much can definitely be brought back, but we do have a lot of prescription drug overdose information, obviously from the Board of Pharmacy data that we receive from them. As far as calculating what that tonnage looks like, we don't have any way to know because we don't know what people took or what may be still available in their cabinets. We know we have reduced the number of prescriptions that are being written for opioids in the state of Mississippi, which is a huge step forward. But on Colonel Maxwell's side, as opioid prescriptions were reduced, illicit opioids are on the rise. And so we're trying very hard between all of us working together to make those things balance out.
We've got a little bit more time with Colonel Maxwell and Jan talking about OD free. I want to make sure we get all that information out there here on Good Things. out more, you can head on over to supertalktv.com to see my guests who are in studio with me today here on Good Things, and they're going to encourage you to go to odfree.org. Lots of websites, lots of good stuff, and I know it can be a tough topic, and that's talking about making Mississippi OD free, but you can play a role in it, and I think that's what I want to make sure we leave with today, and also educated on maybe where are those hot spots around the state or the other sort of tools or resources that are out there. And Colonel Maxwell, I know with the Mississippi Bureau of Narcotics, you guys take hotspots seriously because it's where you kind of deploy probably more work, or you try to figure that out. So what is the data telling us in terms of Mississippi? Where are those hotspots when it comes to drug overdose or just drug use?
So through the data sharing collaborative that Jan mentioned earlier, they've taken a lot of the data that we forwarded to them, and they've been able to merge all those data specifics together. And right now it looks like that Pearl River County is going to be per capita one of our hot spots. And then linearly along the coast, Hancock, Jackson, and Harrison County. And Harrison County, from a numbers perspective, is leading in the state. And then we have, due to our population density in the metro area, that's going to be our second most significant area. And then in North Mississippi, in and around DeSoto County, and also Lafayette County.
And we were just talking, Jan, about having conversations with our kids, college kids, high school kids who, think parents don't know what they're talking about. It's not going to happen to me. I know the buddy who gave it to me. It didn't happen to me last time. I mean, on and on and on. I mean, are there any just good one-liners or, educational pieces to talk to our young kids who are really on the front lines of getting duped when it comes to the things that they're buying? Either one of you can answer that one.
Well, I think the most important thing from a prevention standpoint with our youth, that we also have some work that we do with that with the Public Health Institute, is if the prescription is not written to you, don't take it. You think you know what your friend is telling you, and you think they're telling you the truth, but there are no guarantees in life, and it only takes one pill that has the wrong content with it, and you cannot look at it and tell. The pill presses today that our illicit market is using looks exactly like a pill that you're going to buy from a pharmacist.
I heard you earlier, Dan, talk about linking this to mental health. And sometimes, especially students who are trying to do good, making the grades, juggling all of their social activities, work, all balance, and they're struggling mentally, but they're not talking about it. Maybe they turn to other ways to cope. How can you help, or how can we help better identify or get more educated about seeing it from that end before it gets to the extreme?
Well, the first thing as a parent is, we know our children better than anyone else, or we should. And anytime you see a drastic change in their behavior, they seem too stressed. They seem a little too wired, or they seem like they're not taking interest in things that they ordinarily would take interest in. Those are big red flags, and should be to any parent. But one of the things that we have to do, and we always have to keep those communications open with our children. And I know that we live in a time right now where parents are busy, but there are other people too. People that work with youth groups, anybody that can be someone that children or youth trust. Those are the people that need to pay attention. And sometimes, as parents, we don't want to see those things about our children. But being aware of what's really going on in their lives, who their friends are, where they're going. They'll say, yes, you're being too nosy, or you're controlling my life. Control their life.
I just go back to what you said earlier, Jan. You'll never know who you saved, but you'll know the pill that killed. And I'm like, wow, that's right. That's a tough one to take home, but I think it's what we need to hear. I do want to ask Colonel Maxwell. I mean, if you go through your aging parents, or you have your own pills, and we come back to the take back, are there going to be questions on where we got those or whatever? Is it because there is that level of sort of fear around I'm holding something that wasn't prescribed to me. It's a drug. If you bring it, no questions asked, you guys are just going to take it back and do what you do with it.
Mm-hmm.
So.
Absolutely.
Take Back is it's a format in which all Mississippians can do their part, and they can play a role in saving a life, preventing overdose death, and also preventing the initiation of the misuse and abuse of opioids that may be acquired from a home medicine cabinet or keeping space.
Which I think that's just a good point to make. It's like, don't have any anxiety about it. You know, it's the same way when a police officer gets behind you, you all of a sudden go the speed limit. You make sure you set on cruise control because there's that little bit of like, oh no, you know. But this is our part. This is how we can sort of help and at least remove them from our homes, and our homes won't be, you know, where it finds its way back to the source of something tragic happening. On a fun note, though, Colonel Maxwell, you were sharing earlier how you got into law enforcement. That is such a fun story, and it wasn't something I was expecting. So how did you wind up in law enforcement with the Bureau?
So I was working for Hudson Salvage, I think a company, who all of us are thrifty shoppers is familiar with. And I was in management there, and I was working a stock of boat motors. And a former NBN agent, retired Major Chuck Smith, and an IRS agent came in, and I was able to, finagle them and sell some boat motors to them. And Chuck asked me, he's like, you want to do this for the rest of your life? And I said, not really. I'm kind of interested in law enforcement. And then, ultimately I was hired by NBN, and here I am 27 years later, blessed and fortunate to be the director of NBN, and very thankful to Governor Reeves and Commissioner Tyndall. And I'd also like to say, I know we've talked a lot about, the issues associated with drug-related overdose deaths, but Mississippians should feel really good about this legislative session. Governor Reeves and Commissioner Tyndall, working with Speaker Gunn and Lieutenant Governor Hoseman, were able to push two significant pieces of legislation through this year. Parker's Law, which will create a broadened thoroughfare for us to hold individuals accountable who are predisposed to the knowledge of selling fentanyl or a drug laced with fentanyl. And that bonds very well with another piece of legislation that we got. Jan mentioned it, that requires pill presses to be registered with the Bureau of Narcotics, and the rules will be promulgated by the Mississippi Department of Public Safety. These two laws, in conjunction with an existing statute that we have, which is our Good Samaritan law, I think are three tools that law enforcement, along with district attorneys throughout the state, will be able to use to further hold drug traffickers accountable in Mississippi.
That's just a little bit of bright light to sort of, round up this tougher conversation, Colonel Maxwell, because, Jan, it can feel overwhelming for us just sitting here listening to good things. How do I help? You help just by educating who's in your household and doing the take back. And then hopefully if we all do that, it sort of raises the, awareness piece to it. But how important is it for state agencies to continue to work together and just come out of their silos and partner and utilize all of their best assets for a common goal?
Well, we have several grants through SAMHSA and through the CDC, and as a light on Mississippi, they tell us all the time how impressed they are that we have state agencies that are working together in this way. One of the first calls that we had was SAMHSA, and we actually had the Department of Health and the Department of Mental Health both on that call, surrounding 3 different grants in partnership with MSPHI. They said, "How did you do this?" And my answer was, well, we're from the South, and we all love each other down here. So
we work together.
We work together, and we know we have a problem, and we know we want to solve that. To talk a little bit, too, about what Colonel Maxwell said about the Good Samaritan law, too, I think we'd be remiss if we didn't point out the fact that if someone is experiencing an overdose and you call 911, even unless there are a great number of illicit drugs that in your possession, you are covered under the Good Samaritan law for trying to save a life. And I think that that's very important, particularly with our teenagers. One of our PSAs that we recently put out with the 911 call is teenagers that are making that call, and one of the teenagers says, "You're going to get in trouble, but you're not, if you're making that 911 call and the 911 operator assures them you're not going to get in trouble, you're saving someone's life.
That's another, I think, good piece of information as parents and caregivers we can pass down. It's like, you know what, we try to prevent, but if you find yourself in a squirrely situation, here
Correct.
you are protected. Save your friends, save yourself, call. We'll talk about it later. Let's just get everybody home okay first. Colonel Maxwell, it's like you have to, but I think having teenagers to have that knowledge is powerful as well, because it's a matter of minutes after an incident like that sort of happens. But we can help at least slow it by taking back our pills and being part of the solution. So go to odfree.org. There is a drug take back button, and you can find one of the 102 sites, or they have a contact information there too if you need more information. Well, this was enlightening. Dr. Maxwell, Colonel Maxwell, I'm going to call you everything under the sun but the right thing today. And Miss Jan, it's been a pleasure. I hope to have you back for, happier times, but keep doing the good work. And you guys keep with us. We got a little bit more for you up next.